Welcome to our deep dive into the world of therapy for bipolar disorder.
Sounds good.
We're going beyond just the basics today,
right?
Using this insightful article from Verywell Mind as our guide.
Right.
You probably already know that medication is essential for managing bipolar disorder.
Yeah.
But get this, therapy is like the secret weapon for truly thriving long-term.
Yeah, it's not just about managing symptoms. It's about equipping you with the tools and strategies to navigate this complex condition.
And live a full and meaningful life.
Exactly. Think of it as empowering yourself.
Okay, so let's unpack this together.
Sounds good.
We know bipolar disorder involves intense shifts in mood, swinging between states of depression and mania. But these aren't just your typical ups and downs, right?
Right, we're talking about extremes that can really impact your daily life.
For sure.
Think profound sadness, loss of interest in things you used to love, fatigue during a depressive episode.
Okay.
Then on the flip side, mania might look like racing thoughts, decreased need for sleep, and even increased talkativeness and risk-taking.
Wow.
It's a complex picture.
Yeah.
And each individual experiences it differently.
That's where therapy comes in.
Exactly.
And here's a fascinating fact from the article.
Okay.
Research shows that people who engage in therapy along with medication are 30% less likely to experience another severe episode compared to those relying on medication alone.
Wow, that's amazing.
That's huge.
Yeah.
It's about proactively shaping your experience, not just reacting to symptoms.
Absolutely. It's about taking control and building a life that works for you.
Yeah.
Even with the challenges that bipolar disorder presents.
So ready to explore the therapy toolkit that can help you specifically?
Let's do it.
Let's dive in and see which tools might resonate most with your needs.
Yeah.
First up, we have cognitive behavioral therapy, or CBT.
CBT is all about recognizing and challenging those negative thought patterns that can fuel both depressive and manic episodes. You're essentially rewiring those automatic, often unhelpful thought patterns and replacing them with healthier, more adaptive ones.
So you're not just managing symptoms, you're tackling the root of the issue, right?
Exactly. And research backs this up. CBT is consistently shown to be one of the most effective therapies for bipolar disorder.
That's encouraging to hear.
It is.
Now, we've talked about how CBT rewires thinking patterns, but there's another approach that taps into the power of shared experience and learning.
Okay.
That's group psychoeducation.
Group psychoeducation is all about equipping you with knowledge.
Okay.
You're learning about bipolar disorder, understanding its symptoms, recognizing your early warning signs, and developing healthy routines.
Wow.
What's interesting is that studies show group settings, especially those that involve family members, are incredibly effective.
It makes sense. Having a support system and learning from others' experiences can be so valuable. It's like you're not alone in this journey, and you can gain strength from others who truly understand.
Precisely, that sense of community and shared understanding is incredibly powerful, especially when you're dealing with a complex condition like bipolar disorder.
Now, this next one is interesting to me. Interpersonal and social rhythm therapy, or IPSRT. I think a lot of people can relate to this even if they don't have bipolar disorder.
IPSRT focuses on the connection between your daily routine and your mood stability. You're keeping track of daily activities, especially sleep, eating, and exercise to establish consistent patterns.
Like that morning coffee ritual we all rely on to get going.
Exactly. By maintaining these rhythms, people can often minimize those intense mood swings and feel more balanced overall. I've actually seen the incredible impact of this firsthand. I had a patient who, by simply regulating their sleep cycle, went from near constant mood swings to a place of stability they hadn't experienced in years. It was truly remarkable.
Wow, that's a powerful example of how seemingly small changes can have a big impact. It's about taking an active role in your well-being and recognizing those patterns that influence your mood.
Absolutely. Yeah. And that sense of control can be incredibly empowering. It shows that you're not just at the mercy of your condition, you can actively shape your experience.
Speaking of support, family-focused therapy, or FFT, seems like another powerful tool in that toolkit.
Absolutely. FFT recognizes that bipolar disorder doesn't just impact the individual, it affects the whole family system. This therapy involves family members in the process working to improve understanding, communication, and support within the unit.
It's about everyone being on the same page, working together, right?
Exactly. Family members learn how to best support their loved one with bipolar disorder, while also addressing any challenges or conflicts that might arise. This creates a stronger, more supportive environment for everyone involved.
And last but not least, we have peer support programs. I imagine these can be so valuable, especially for those who feel isolated in their experience.
Peer support is incredibly powerful.
Yeah.
It's about connecting with others who truly understand what you're going through. These programs, whether online or in person, offer empathy, practical advice, and a sense of belonging.
It's that reminder that you're not alone, and there's a community out there ready to support you. And the fact that these programs can be found both online and in person is fantastic. It makes this type of support accessible to almost anyone. So we covered a lot of ground here, from CBT to group therapy and peer support, and it's clear that therapy offers a diverse set of tools to help you manage bipolar disorder effectively. But it's not just about managing symptoms, is it? It seems like therapy can have a ripple effect,
Right.
positively impacting all areas of your life.
Absolutely.
It's not just about surviving with bipolar disorder, it's about thriving. What do you say?
It's about reclaiming your agency and living a full, meaningful life, even with the challenges that bipolar disorder can bring.
Yeah.
And that brings us to a really important question. What are the tangible benefits you can expect from therapy?
That's what we really want to understand, right?
Yeah.
What's in it for me? If I commit to this journey, what can I hope to gain?
Well, here's what's fascinating. Therapy doesn't just help you manage symptoms. It can actually improve the overall course of bipolar disorder.
Really?
Studies have shown that people who engage in therapy alongside medication tend to recover from episodes faster
Wow.
and have a lower risk of those episodes returning.
That's amazing.
It's like you're building resilience and equipping yourself to handle whatever comes your way.
So it's not just about putting out fires, it's about preventing them in the first place. That's a game changer.
Exactly. And beyond symptom management, therapy equips you with skills to navigate everyday life more effectively.
Okay.
It can improve your relationships, boost your self-esteem, and enhance your overall well-being. It's a holistic approach that touches every aspect of your life.
Okay, so let's say someone is listening to this and thinking, this all sounds great, but how do I actually get started with therapy? What would you advise?
The first step is often the simplest: talk to your doctor or psychiatrist.
Okay.
They can assess your needs and provide recommendations for therapists who specialize in bipolar disorder. Think of them as your trusted guide to help navigate the mental health landscape.
Makes sense. It can feel overwhelming to know where to start. So having that professional guidance can make a big difference.
Absolutely. And don't forget about your insurance provider.
Oh, right.
They usually have lists of therapists in your network. Also, organizations like the International Bipolar Foundation and the Depression and Bipolar Support Alliance are fantastic resources for finding local therapists.
Great.
You have options, and there are people ready to help you find the right path.
And I think it's important to remember that finding the right therapist is a bit like finding the right pair of shoes. You might need to try on a few before you find the perfect fit.
I love that analogy. It's so true. You want to find someone you feel comfortable with, someone you trust, and someone you can openly share your thoughts and feelings with. Don't hesitate to try different therapists until you find that right fit. Your mental health journey is a personal one, and finding the right guide can make all the difference.
So we've covered the types of therapy, the benefits, and even how to get started.
We have.
But before we wrap up, I think it's important to circle back to the symptoms of bipolar disorder.
Yeah.
The article highlighted how intense these swings between depression and mania can be. Can you walk us through what those might look like?
Absolutely. Remember, those mood swings are a hallmark of bipolar disorder.
Okay.
During a depressive episode, you might experience profound sadness, loss of interest in things you used to enjoy, fatigue, sleep disturbances, changes in appetite, and even thoughts of self-harm.
It sounds incredibly draining and isolating, like a heavy weight you're carrying. And then on the other end of the spectrum, there's mania. What does that look like?
Mania can manifest in different ways. Some people experience euphoria, a heightened sense of energy, grandiosity, racing thoughts, decreased need for sleep, and increased talkativeness. Others might experience irritability, agitation, and even aggression during a manic episode. It's a wide range, and it's important to remember that not everyone experiences bipolar disorder in the same way. Symptoms can vary significantly from person to person.
Wow, that's a stark contrast to the depressive symptoms. It really highlights the extreme nature of this condition. And that's why finding the right treatment plan, including the right type of therapy, is so individualized, right? It's not a one-size-fits-all approach.
Precisely. That's where the expertise of a mental health professional is essential.
Okay.
They can help tailor a treatment plan that addresses your specific needs and challenges, helping you find the path that's right for you. So to bring it all together, we've covered the different types of therapy, explored the benefits, and even touched on the symptoms of bipolar disorder and how to get started with treatment.
It's been a comprehensive deep dive for sure. But before I move to the outro, I'd love to get your perspective on the key takeaways for our listener. What do you want them to walk away with today?
I think the most important takeaway is that therapy is an essential part of managing bipolar disorder. It's not just a nice to have, it's a must have alongside medication. Therapy provides you with knowledge, coping skills, and the support to navigate the ups and downs of this condition.
It's about becoming an active participant in your mental health journey.
Exactly. It's about reclaiming control, finding balance, and living a fulfilling life, even with bipolar disorder. Remember, you have the power to shape your experience.
I love that it's such a hopeful and empowering message.
It is.
And speaking of empowerment, we've explored all these different therapy options, from CBT and group therapy to family-focused therapy and peer support.
Yeah.
What stands out to you?
That's a good question.
Which approach resonates most with your personal experiences or what you've learned today?
Well, I think really depends on the individual and their specific needs.
Right.
But I've seen incredible success with all of these approaches.
Yeah.
It's really about finding what works best for you.
Exactly. There's no one-size-fits-all approach to mental health.
For sure.
And remember, no matter where you are on your journey with bipolar disorder, you deserve support and you deserve a full life.
Absolutely.
Therapy can be that powerful tool to help you get there. Beautifully said. Thanks for joining us on this deep dive into therapy for bipolar disorder.
Thanks for having me.
Until next time, keep exploring, keep learning, and keep diving deep.